Nursing students, time to talk. Welcome to the Real Talk School of Nursing podcast. It's been a long time. I'm your good and faithful host, Michael Smith. It's great to be back. Thank you so much for your patience in the delayed episode schedule. I probably don't have to explain to you how busy and how crazy things can get. I'm working really hard every day to make sure that I'm ready for my next NCLEX retest. It's coming up really fast. But anyway, I'm still working on getting every episode to have 3 segments. I'll talk about this more later and you'll see it in the shows. But this is where I'm really going to need some help from you to share your experiences, ask questions, and give feedback. So write into the show, realtalknursing@gmail.com, or use Facebook Messenger, or contact us through Instagram or on Twitter. Thank you to everyone who started following us on Instagram, Twitter, and Facebook. Speaking of that, we hit 1,300 followers in our Facebook page last month. That's crazy. More listeners means more and better shows. Make sure to share the episode. I have lots in the works, but for now, let's just get things going. If you like the show, the Real Talk School of Nursing podcast is available on iTunes, Google Play, iHeartRadio, Libsyn Web Player, Stitcher, YouTube, Spotify, and SoundCloud, and probably some more that I can't remember off the top of my head. So go to wherever you download podcasts, subscribe, rate us, review us, right into the show, smash that subscribe button, and remember to leave only 5-star reviews because that's the only ratings that count to get us noticed by more nursing students. So write into the show at realtalknursing@gmail.com or on Facebook Messenger. You can also join us on Facebook, Twitter, and Instagram. I try to post something inspiring, thoughtful, something like that every day. I'd like to say something, that I post stuff that's funny, but I really don't have any idea if you find humor in the things that I find funny. So maybe it's better if I just say, I post things that are entertaining, at least to me. We're building a community of fun and supportive nursing students, and I want you to be a part of this crazy nursing school journey. So, let's get going. Okay, guys, so here's segment number 1. So we're going to talk about some prereq student issues, and that's the first place that I'm going to go. I'm going to try to do this, the first of 3 segments I'm going to try to do in each of the podcasts here. So, first, again, I will show my appreciation to you guys who have kept on, and it's been a month. I realize that it's been like a full month, or almost a full month, or maybe even more than a full month. My gosh, has it been more than a full month since I've done an episode? Whew, sorry guys. Well, and I really actually feel really out of practice too, but we're going to get through this. So the question or the statement that I'm going to focus on comes from one of the listeners, and I'll just read it outright. I still have prereqs left, but I'm worried about actual nursing school once I get that far. I'm married and I have 3 kids. I'm so worried about the stress nursing school is going to bring to myself and my family. I keep reading everyone's horror stories about nursing school, and that's the one thing that kept me from following my dream over the last 10 years. I scroll through my newsfeed, and all of the nursing groups I am in, have a ton of posts about nursing school being awful, etc. So here's my response to that. So let's break this down into each of its components. So number 1, nursing school will put stress on your family. It will. Your family is going to miss you. You are going to miss your family. There are some major time commitments in nursing school. So let me tell you about the first few papers that I wrote in nursing school and how much time went to each one writing it. So my first nursing school paper was on fall reduction, and it took just 32 hours to write and edit. My first full care plan was 21 single-space pages and took over 40 total hours of writing and editing. My first interview paper in my second term was about trauma leading to osteomyelitis, leading to amputation. It was just, 15 pages. No big deal. Edited down significantly because of the rubric requirements, and total editing time was about 76 hours. My adult, versus pediatric, my first adult care plan in my second term was 23 single-space pages and required over 80 hours of writing and editing. My last really acute care plan was 27 pages, single-spaced of course, and took 45 hours to complete. Of course, I had, more time under my belt, and I was much more efficient with my time, and still took 45 hours to complete. Just so you don't think this is like really crazy. So we would do like a 4-day clinical, and then we'd have 4 days afterwards to turn in this humongous monstrosity of a care plan. It was literally 27 pages and not a lot of dead space between. So the last big writing project that I did in nursing school, my thesis was 54 pages. It spanned 9 months of time for research and editing and reading through hundreds of articles to find what I needed to write the thesis. It was about 120 hours of just writing. This doesn't include research or anything. So the point is, there are going to be a lot of times when you are going to have to stay home from a trip to the parents for the weekend. If you have a family, they're going to go, up to your spouse's, parents or something like that, and you're going to need to stay home, or there's going to be some family event or something like that. And you will all go through nursing school together. If you have a family, you are all going to go through nursing school together. Everyone is going to sacrifice, and everyone is going to suffer. Maybe not as much as you, but they're suffering in their own way. Your kids don't really have any control over, and I realize you don't really have any control over, what nursing school is making you do either, but, they really don't have any control over what's going on. And there's no getting around it. By the end of nursing school, you are going to miss out on a lot of family stuff. So let's break it down. The next thing is your kids. Your kids are going to miss you. Your spouse is going to have to pick up the slack that you leave behind, whether it's shoveling the driveway, house repairs, laundry, grocery shopping, meal prep, laundry, picking up and dropping off the kids. There's going to be a big, a void that you filled before, and nursing school is going to fill that and more. So, if you have parents or in-laws in the area, ask them straight out for help. It's tough. You're going to need the extra help, and sometimes you need a babysitter for, a quick date night or something like that. The next thing that I think is important to address is that nursing school is awful. It's also pretty cool. You don't really get to do these kinds of things in other professions. Sure, there are x-ray techs who get to see lots of cool things, but they don't get, but they won't see angiograms. And there are tons of other things that you as a nurse are going to see, a wide variety of things that a lot of, of the specialty, techs and other people who work in healthcare, they see a very small portion. And nurses, I think, see a much wider portion of it, even once, nurses specialize into their, whether it's ED or NICU or PACU or whatever. So yeah. Let's see. That's right. I had another one. So I start pre-nursing this fall. This is from another listener. It says, I start pre-nursing this fall. As I mentioned before that, I'm working towards my BSN in a traditional 4-year college. Sorry, this was kind of an ongoing thing. Do you have any other medical experience? Or, do you have to have any other medical experience, or at least have a medical assistant diploma? For people, if you talk to a lot of nurses, you will say that, or they will say that they think that being like a CNA should be a prereq to you going through nursing school. And while I think that you can learn a lot of very important things as a CNA or an NA or a tech or, kind of whatever, I think you can still be a good nurse without that. Having said that, it's really great being in an environment where, you network with people. most people who have been listening to the show a while, Ben and Greg were both EMTs and they worked in an ER, as did I. So, and I worked for about 3 years as an EMT, and it was really helpful because there's things that you just get to see and experience that a lot of your classmates maybe won't. I think it's also very useful for you to be kind of down in the trenches a little bit and understand. If you're a nurse, I think it's easier to understand when you're asking an NA to do something for you. You've done that, and you understand what you're asking them to do. And I think I think it's easier to show a little bit of appreciation, or, I think it's easier when you've been down in the trenches to kind of understand what they're going through. And I think that's a really good perspective to have. Now, having said that, I also think that sometimes experience can create a deficit for you in nursing school, because there's a lot of circumstances, and I'm, I can only talk from my experience, but I think when you are in nursing school, it's really easy to imagine the exact circumstances that you're reading about in a question, and imagine what the nurses, doctors, and what you did there. There'll be some question about, like, well, what did this LPN do? Or what did this, what did a UAP, an unlicensed assistive personnel, do? So what did the PCT, the patient care technician, what did they do in that circumstance? And you go, well, I do blood draws all the time, or I can get this, I can do that, or, whatever. And that's real life. And when you're answering nursing like book questions, I think sometimes that experience can be a deficit because it's not book nursing, and that's what you really have to kind of worry about, and that's kind of that's how you have to answer these questions. So sometimes I think it can be, there's some downside to having experience like that, and I struggle with that even today. Like I went through a 26-month program, and I'm studying for the NCLEX, and I've done like 4,000 questions between my first attempt and the second attempt here. And yeah, it's like I still get, because it's so easy to fall back on that experience, that I think sometimes it can be kind of a downside for you. So I don't think you have to have medical experience. In fact, I think that some of the people who don't probably have an easier time with tests. But I think once you're out of school, I think having that experience is going to be a huge benefit to you. I think it's going to benefit you most if you can separate those two things. If you can separate in your mind, school from experience, book knowledge from what happens in real life. I think that's a big thing. And there's a big debate on why there is such a, why nurses have to learn, new nurses have to learn so much about, why new nurses have to learn so much between nursing school, where they're supposed to acquire all this knowledge, and getting through nursing school and then getting into the profession. Like, there's a big gap there. And I think a lot of it is because, the books want book knowledge, and they're not meeting in the middle. And so there is a big deficit. So I think having prior experience can kind of help you bridge that gap a little bit. So, all right. So we'll move on to segment number 2 after this word from our sponsor.
Are you tired of the same old badge reel? Do you have to wear the same scrub color as everyone else?
Are your undershirts boring and kinda stinky after wearing your lucky shirt through 5-in-a-row 12s? You can wear personality in other ways. Go to badgeladybynerdwear.com and check out her crazy selection. She also takes custom orders on a limited basis. Tell her you're a Real Talk School of Nursing podcast listener. Be nice to her and she'll be nice to us. It might take 2 or 3 weeks for custom orders, and you can probably count on a few days, depending on her actual job schedule, to get your badges shipped. I know you'll treat her like your best friend at clinicals, so go to badgeladybynerdwear.com and order the coolest badge reels out there. badgeladybynerdwear.com and tell her you're a Real Talk School of Nursing podcast listener. All right, well, welcome back. So we're going to talk about nursing graduates, so, people who are getting ready for the NCLEX. And obviously there's a lot to kind of dig into and stuff like that. And again, I can only talk about things from my experience and from my perspective. So if it doesn't fit exactly what you've heard or whatever else, don't take it as gospel. Just take it as some dumb schlub on a microphone, and this is just my opinion. So one of the really strange things about failing my first attempt at the NCLEX are actually some of the benefits. First, and this is something I stated in, I think, my very first episode, which is episode 49, was that this test is a big monster on a hill. And after someone passes their exam, you never hear from them. You never hear from them again. And they certainly don't don't start going back through all the study materials to see how things compared. So this, for you listening, is probably the best benefit of me not passing the NCLEX the first time. You benefit from my experience, and hopefully I can guide you away from some of the things that I don't think are worth it. I always say, I should lead with my mistakes, or you should lead with your mistakes, and I think that gives you credibility in a lot of ways. I have nothing to hide. You should always know where I'm coming from, and I always try to be very frank and honest with people. Nobody's perfect, and I made it through prereqs and nursing school without a hitch. It figures that I'd hit a road bump, somewhere along the line, and you know what, I kind of hate getting advice from people who never made a mistake or hit a speed bump. I can remember being in the Army, and some officer would come down from my battalion staff. And, I knew these guys. They were all fighters, but as a platoon leader, I hadn't slept in 3 days, literally like 3 days. Like, it was not uncommon to be out in the field, and, maybe if you shut your eyes for 15, 20 minutes a night, like, that would be super normal for, a week-long field problem. I hadn't showered in 5 days. I was dirt, mud, and sweat from head to toe, and as happened every single time we had a week-long problem, we had a 20-mile road march back to our company building that would start at about midnight, and, when this clean, uniform staff puke would come down and try to give me advice, it was sometimes difficult to take. So I'm here giving you advice from the trenches. I'm fighting right alongside you. I'm here with you, and I'm experiencing this in all of this in real time. So there it is. So the second benefit is that I get 6 weeks more to study. It doesn't sound like a benefit because maintaining the level of intensity that I think is needed to study effectively, I think is really hard to do. And I mean, today I'm recording. It's 1:34 a.m. on Monday, and yeah, it's like today I was so distractible. It was awful. Like I literally got so little done today, but it takes time to get through this stuff, and I think that's time that I wasn't able to take the first time. So the third benefit is I have time to do things with the family. Like I take my daughter to dance and both my kids to soccer. I can clean around the house. I can make meals. I even spend time with friends a little bit and sleep. I'm still not getting adequate sleep, but it was a lot more than I was getting before I took my first exam. So, again, great benefit. I've also been doing a lot more with NRS&G and using their SimCLEX exam. I've passed like 5 at 75 questions, and I think those things are going well. So let's talk about a little bit of the test prep things, the test prep resources that are available, and just the stuff that I've used. So the first one up is Kaplan. I've been using Kaplan for a couple of years, since the very beginning of my program, which was January 2017, I think, something like that. So starting in January 2017 is when I first encountered Kaplan as part of a nursing program. And one thing I will say about Kaplan is I like their process, even if, there are some issues with it. And I appreciate their scoring using, the NCSBN question categories. So again, or if you're hearing it for the first time, management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, pharmacology, and the word that I can never say, physiological adaptation, and reduction of risk potential. But here's what I hate about them: their infallibility. Have you, as a prereq student or a nursing student or just a regular student, had an instructor who wouldn't admit any level of being wrong? Like saying that the trigeminal nerve is cranial nerve number 13, or, something simple, something silly or verifiably wrong. That's Kaplan. I swear to God, if I found, just a simple typo, hey, there's 2 periods at the end of this sentence, they would argue with me, or they would tell me that, 2 sentences completely normal and I'm wrong. I'll go through their questions, and even knowing the answer, there are lots where you can't even reverse engineer the answer. And, sometimes they'll prioritize like a mild rash over a choking patient, overemphasized for effect, obviously. But it really, because the answer has to do with the topic. And so a lot of things that you would be like, well, yeah, of course I'm going to go see that. And I was like, well, that doesn't really have anything to do with that, because that's not related to the topic of the question. So it can feel a little bit wonky, and it's a little bit difficult sometimes to swallow and stuff like that. But, appreciate it for what it is. I feel like there is a lot of subjectivity in their questions. Like people who write them are prioritizing things, not using a system or the principles of care or the nursing process or Maslow's theory. And sometimes they can explain their answer because the answer or the priority answer doesn't have anything to do with the question topic, like I was saying, but that only goes so far. So I've done, about 4,000 questions with them, and I'm just finding myself more and more frustrated with the questions and the answer choices. I know, accept it as, part of the testism, accept these things as truths, no matter how stupid and how wrong they are, because that's what we have to do to make it past a test. But I see the larger issue too. And, if you're working in healthcare, you sometimes see new nurses come on, and many of them seem completely underprepared for their jobs. Like there's a huge gap between their education and their readiness for their professional life. And I think it's things like these tests. One of the Kaplan experts, because they will actually email you back and forth, and Kaplan also has an active chat available in the afternoons on the weekdays, which is, great. I mean, it really is. I mean, that's a big benefit. But one of the Kaplan experts stated that what you do in the real world and what you do in a test are very different. And the question is, should they be? Who does that help? So, why make questions that statistically no one can answer? I don't know, but that seems silly to concentrate so much on making things so difficult, and questions, so difficult that they require so many mental backflips, and none of the answers are right either. And I'm not talking about the questions that have multiple correct answer and you have to prioritize them, and pick an answer, based on what the what the question topic is. I get that. I'm talking about the types of questions where all of the answers are wrong and you have to choose the least wrong. I'll give you an example. And here's the question. The nurse... Oh, man, I can't get this. Sorry. The nurse provides care for an older adult client after a total hip replacement. A left total hip replacement. Which finding will the nurse be most concerned about? Number 1, the client is positioned with a pillow between the legs. Number 2, the client moves slowly when getting out of bed. Number 3, the client's heels are on the bed with toes pointed upward. Number 4, the client uses an incentive spirometer every 2 hours. They say the correct answer is number 3 because the client is at an increased risk for skin breakdown. It's important to keep the client's heels off of the bed to prevent skin breakdown. I answered number 4 because of the possible immobility issues, breathing, airway issues that can occur, and the textbook answer is that we are supposed to use the incentive spirometer 10 times per hour, not every 2 hours. So I answered that, with that, seeing that they, were both only potential problems, but airway potential problem over skin integrity potential problem, it is what it is. So they answered back with, you are correct in that there is a potential for skin breakdown. I was referring to the idea of the heels lying on the bed as being a definite or actual violation of practice guidelines, while using the incentive spirometer is a not ideal situation rather than a clear violation. So in essence, the answer here is picking the least incorrect rather than the most correct. And this is continually frustrating to me. And that's Kaplan. So let's move on to UWorld. UWorld is a subscription that I got recently. And remember when I said that, at least for the purposes of the show, it's been kind of useful to have seen the NCLEX RN exam and then gone back to the services like Kaplan, NRS&G, and UWorld, along with a few books to really see what seems to match, at least, again, from my perspective. That said, I'm not being sponsored by UWorld, but at this point, I kind of wish I was, because I really like their content. I think the language that they use is really close to how questions are phrased, and even after more than 2,000 questions on Kaplan, I'm seeing a lot of stuff that I hadn't encountered before. And as far as I've seen, their rationales are really great. The one thing I wish they did was break down their questions into the NCSBN categories. I think that would be really helpful. Right now I'm just kind of hand jamming it and doing it on my own. The NCSBN categories, again, if you are just getting used to this stuff, so management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, pharmacology, that's a word I can't say ever, physiological adaptation, and reduction in risk potential. And NRS&G has much more specific content categories, and so there's, but I think they're so specific that I think it's difficult to get an idea on how you're doing in a particular section. Because if you get, I don't know, pick a very specific topic, you might only get one question, in 300 questions or something like that, but you get that one wrong, and so like, okay, well, you have one category that's a 0. Well, that doesn't really help, and that kind of drags down your your percentages and stuff like that. So like, I don't think it's as useful to be that specific when you're talking about content areas. Whereas UWorld has broader categories like adult health, child health, critical care, fundamentals, leadership and management, maternal and newborn health, mental health, and pharmacology. So I wish that I had gotten a subscription to UWorld earlier. Now, to caveat that, I think that even if I had UWorld the whole time, I don't think that it would have mattered. I still would have rushed the last exam, and I said it last time, but I'll repeat what I said because it bears repeating. slow down. Read the stinking questions. Even today, like I got caught in a couple questions where I was supposed to find something like, find the statement that reflects the patient needing further teaching. And of course I choose the right answer instead of the wrong answer that it was asking for. So even knowing what I know, it's hard. Like, it's a hard test, and it's easy to skip over that stuff. So give yourself a break, but slow down and read everything. So in the end, I'm liking eWorld so far. I have really liked their questions, and having actually seen the NCLEX already, again, and needing to look at all the study material again, I can say that the questions and the answer choices are much closer to what the actual NCLEX, what the NCLEX is like than Kaplan. For sure, Kaplan. I also really like their rationales. Again, much, much better. They also have a graphic so you can actually see what they're talking about. They'll have pictures and stuff like that within their explanations. And, I think that really helps versus, I've posted some of the stuff on Facebook from Kaplan where like the explanation is, the question answering strategy is consider each question. Oh, thanks, Kaplan. Like super helpful. All right. So moving on, NRSNG Academy. The commercial has been on here since the beginning. So here's the pros of NRSNG Academy. Their online content is very active. Their online community is really active on their members only Facebook page. So that's very helpful, and you can bounce questions off of each other, and that's really helpful. Here, hold on a second. I've talked about it. They have a really solid SimCLEX, I think. They break down the SimCLEX results in both content categories and the NCLEX categories, which is really helpful. Their content videos and their lessons are very good. They're short and to the point. Now, there's some cons. They do have some drawbacks. Not much, but they do. Their videos don't go into depth really as much as needed for some of the very specific and in-depth question or in-depth knowledge that's needed to answer the very difficult questions in the NCLEX and in nursing school too. I think they're really good to build a good foundation, but it still requires you to do a lot of work. And you should, because this is your livelihood you're studying for. This isn't, so you can get a degree and go off and do something completely unrelated. This is for your future. So you should be looking at a book, but NCLEX does have some really good foundational stuff, but I don't think they go into depth enough for the purposes of the NCLEX and tests. So they do require you, I think it should require you to go further in and by using your textbooks to study and stuff. I think their questions are easy to read and understand, but I think many of their questions are just too simple, and not simple in concept, but simple in language. They're not too easy, but they're too simple. The language that they use to write questions is much different from the NCLEX. And it's like the difference between reading a novel, NRSNG, versus reading a technical manual like the NCLEX. So, I think there's a language difference. And I think there's use in that. I do, because what are you doing when you're studying? You're trying to learn concepts, and you're trying to learn content and stuff like that. And honestly, I think there's some drawbacks to always reading it in the NCLEX style, like literal NCLEX style way of reading questions. It does take some getting used to, but I think if you're doing a lot of testing and stuff like that, I think it's useful to also just read a question to see if you know something, not to see how good you are at interpreting, the little stupid word nuances that they have, in NCLEX testings. So putting it all together, a comparison. The questions on Kaplan read much more like the NCLEX than NRS&G. UWorld's answer choices have much less difference between them, and I think they're closer to the actual NCLEX exam, in my experience, than Kaplan. If I could just pull little things out and stuff like that, I think that the decision tree with Kaplan is very helpful for some questions. And I was using it very, very heavily after I failed the first NCLEX exam, and I've kind of gotten back away from it because it's just part of the thought process. UWorld, I think, has probably the best rationales and is probably the most user-friendly when it comes to remediation between quizzes and tests, or however you figure it out. And Kaplan, I think, is probably the easiest to navigate, but I think there's I think they have like a lot of computer glitches, and their NCLEX experts, I think, can be really off-putting. So there you go. So if you're looking forward to getting ready for the NCLEX, I don't have any experience with HESI or ATI except for when I had to take the TEAS test, way back when, but I don't have experience with those. I've also listened to some of the Mark Klimek audio that floats around the internet. I think that's really useful. I really wish that I lived closer where I could go to a live review, because I think that'd be really great. And maybe that's something that I'll do later on as part of the show, but it costs a fair amount of money. So we're going to need a lot more sponsors. So you guys are going to have to really really share the show in order to pay for that kind of thing. But anyway, so we'll end there and kind of keep moving on. All right, well, welcome back as we wrap up this long-awaited episode. Okay, so watch Facebook and Instagram this month for the big reveal. I still have the big surprises coming. So here's the deal. If you get your name drawn this week, you get your pick of one of the 4 Badge Lady by Nerdware badge reels. You have to email the show at realtalknursing@gmail.com or using the Facebook Messenger and Instagram Messenger too. So you can email me on that. That's fine. Let me know which prize you want, your address, and I'll send you the badge of your choice the same day you write back into the show. This is a first come, first served deal. So if there's one badge you really want, you better write in fast. And I'm only going to announce it on this podcast here, so I'm not going to put out names on any of the social media. So, if nobody claims, 1 or 2 of them or something like that this week, I might have to give them away. I might have to do another drawing or something like that with the remaining badges. So hopefully that doesn't happen. I'm just, being cautious. Also this month, again, like I started off saying, we're going to be doing the big reveal on my big surprise. It's been a long time coming, so keep your eyes open for those posts. Like the page and keep sharing with your friends and classmates. Thank you so much for everybody who's liked the page and who's, sharing posts and stuff like that. It really means a lot to me that you're spending your valuable time, with us on the podcast, on Facebook, on Twitter, and on Instagram. Don't forget Ben and Greg's show, the Shift Report podcast, which you can find wherever you download podcasts, and they're also on Instagram. They're mainly on Instagram, and they do a lot of stuff. So here, let me reach behind me and get my drawing box. It's there's quite a few entries in here. You can hear them. It's a very expensive Diet Coke box, so we're gonna mix them up and I'm gonna draw out 4. All right, so let's see. The first one is tardive Dyskinesia. Okay, I don't know how some of my cards got mixed in. All right, so the first one is Tabitha Jones Stanfield. So Tabitha Jones Stanfield from Facebook, right into the show. You have your pick of one of the badges. So number 2 here. Let's do it. All right. All right. Prissy Bina 29 from Instagram. I think her name's Priscilla, but her Instagram handle is Prissy Bina 29. So Prissy Bina 29, you are one of the 4 winners. So, all right, here we go. Another one. Let's see. Sorry, couldn't get that one open. Aubrey Rose from Facebook. You are one of our winners. All right, and the last one, the last of the 4 badges. Last of the 4 badge winners here is. Oh boy, it's another note card of mine. I don't know how these things are getting mixed in. So, false alarm. All right, Mandy Kuntz. Mandy Kuntz, also from our Facebook page. So, all right, here's the 4 names again. All right, Mandy Kuntz from Facebook. Aubrey Rose, also from Facebook. Tabitha Jones, also from Facebook. And Prissy Bina 29 from our Instagram page. So if you are one of these 4 people, you need to write into the show, use the Facebook page, use Instagram, or you can write in using your email address or to our email address, realtalknursing@gmail.com. And so please write in, and when you get your badge, when you send me your address, when you get your badge from us, your badge lady by Nerdware Badge Reel from Real Talk School of Nursing podcast, snap a picture of you with your new badge on and share it, and I'll make sure that it hits both my page or our page and Badge Lady's page. She's awesome. If you haven't gone over to her page and seen what she has a lot of really great stuff. So I encourage you to spend a little time over there and buy some stuff from her. She'll treat us right. So just, be patient with her. She's, just one person doing all of this stuff. So yeah, congratulations to our 4 winners. Write in as soon as you can, and we'll keep this ride going. All right. Love you guys. Talk to you later. It was awesome being back on the microphone again with you today. I had a lot of fun, and I'm really excited to keep this podcast going. There's more to nursing school and the NCLEX than just content. Remember, in nursing school, the only easy day was yesterday. This show isn't about solving your problems, but you should know that you don't face them alone. We can get through this. We can get through it together. You're not the first person to experience this, and you won't be the last. But we can get through it together. I promise. This Real Talk School of Nursing podcast is a Real Talk production. This podcast is dedicated, as always, in loving memory of Doc Thompson. To his wife and his family, my continued prayers and support.
Sic semper tyrannis, facta non verba.
Good night, Steve Cannon. Wherever you are. Annyeong kasayo. Now, you go home. The Real Talk School of Nursing podcast is a holy moly, I can't believe you're still listening to this podcast.